Hello, hello. Welcome to another session. Today, we are doing the topic Science of Support, the Guide to Psychological Skills. Right. So, today we have with us Daniel Balva, or Dr. Daniel Balva. Daniel is a licensed psychologist, mental health counselor, national certified counselor, and certified rehabilitation counselor. He's a staff psychologist in the Mental Health and Behavioral Sciences Clinic at the West Palm Beach Veterans Affairs Medical Center in Florida, USA. Yes, he's American. Don't hold that against him. Daniel graduated from the University of Georgia with his PhD in counseling psychology, and from the Florida International University with his master's degree in clinical mental health counseling and rehabilitation counseling. He's the past president of the American Rehabilitation Counseling Association and a council member for the Voice of the People Global Cohort. Daniel has a strong passion for global mental health, capacity building, and disability education and awareness, all of which form the basis of his research and clinical interests, as well as leadership involvement in various international organizations. An absolute pleasure to have you with us again, Daniel.
Thank you so much, Daniel, for having me.
And if you haven't had enough of Daniel's, we have another one. So if you don't know me, I'm Dr. Daniel Page. My background is also in psychology and molecular biology. I studied here in South Africa as well as overseas and focused on psychological skills. That's my expertise, and that's what I did in the nonprofit I started, the Positive Youth Development Foundation, and more recently what we do at Psyche Innovations, making mental health and psychological skills available to as many people as possible. And that's part of what we will be talking about today. Right. So what are we talking about today? We're going to be discussing and understanding what psychological skills are, how they can be integrated into practice in a range of different settings. We'll be looking at a few examples of popular evidence-based psychological skills. We'll then be looking at some of the science behind it and how we can go from knowledge to behavior change. We'll then also be discussing some case scenarios, so trying to give some real examples. And then we'll be wrapping up with what it is we do at Psyche Innovations and kind of our core approach here. Daniel and I will hopefully be having an interesting conversation, sort of riffing off each other as well as presenting on some of the content. As always, we'd love you to sort of ask questions as we're going. Hopefully we can answer them. If we can't, we'll try to get back to you at a later stage with hopefully some insights on those questions. So let's begin. Before I start diving into the content, I actually want to pose a question to the audience. We'd love to see your feedback and your answers as we're going. So the question is, what's one psychological skill you believe everyone should learn and why? Right. So what are psychological skills? So the term psychological skills in the literature, the academic literature, and in practice, it's a pretty broad umbrella term for a bunch of different sort of like concepts. So they're often called mental skills, especially in the sports psychology space. They're also called life skills. They can be called intervention skills. They can be called adjunct to therapy skills. So there really is a lot of different terms that are used here. And there are so many of them, and they fit into all these different domains of well-being and wellness that we'll sort of speak about in more detail later, especially sort of our approach at Psyche Innovations regarding those domains. But really they're practical, mostly mental and psychological skills that people can learn and implement in their day-to-day life. So there are things like how we manage anger, how we ask for help, so help-seeking skills, It can be skills that we learn to actually support other people, so psychological first aid, which is obviously encompasses a whole bunch of different skills like active listening, whatever, can also be thought of in some ways as a psychological skill. So yeah, they often form part of different therapeutic approaches and can be used in a bunch of different modalities. Daniel will obviously have his perspectives on this, but it's my sort of understanding and belief that psychological skills can really be used in any modality, but they are often used more regularly in some specific ones. So that's CBT or cognitive behavioral therapy, DBT, ACT. So those are some of the core ones. And maybe this is a good time to sort of get your perspective, Dan. How are they kind of used in these different modalities as a clinician?
It's a great question. So ultimately, one thing that comes up is when I work with clients, I tell them, from the start, as we get to know one another, I say, look, my ultimate goal within therapy is for you to put me out of a job, right? My goal is, for you to become your own therapist in a way, right? For you to be able to learn as many skills as possible so that you can have that sense of, independence and autonomy so that you don't, need me for the rest of your life, right? And so ultimately, regardless of, the therapeutic approach that any clinician utilizes with their client or patient, we want to teach them skills so that they have that level of autonomy to become their own therapist, so to speak, later on, right? And so we see it really with any therapeutic approach. We are constantly teaching different types of skills, even just the skill of being open to seeking help with someone, or even just talking to somebody, which could be a wonderful skill in and of itself. We see it across the board.
I love that. Ultimately, replacing a therapist by obviously having autonomy and this kind of toolbox of skills that we can draw on, which is a bit of a theme that we're going to explore later. And I guess to answer the question that we're putting to the audience, what's one psychological skill you believe everyone should learn? Obviously, it's a bit of an unfair question because there's so many good ones. And we use them to varying degrees at different times. And I think for me at the moment, I'm really trying to do a lot of self-introspection to sort of reevaluate what's going on in my life. So all those self-reflection skills are things that I'm drawing on at the moment. And also trying to practice negative thought stoppage I have a tendency of being quite self-critical, maybe sometimes a tad even perfectionistic. And those are kind of the skills that I'm trying to focus on at the moment. Do you find when you're working that it's kind of obvious which skill you should be teaching somebody in a clinical setting, or how does that approach work for you, Dan?
Yeah, I think that's a great question. I appreciate, Daniel, what you mentioned about the skills that you're learning and trying to implement into your daily practice as well. Something that I just love about therapy is the fact that it can look so different, across the board with different patients, even if it's the same presenting concern. And so I may have, in my mind, a specific skill that I'm like, okay, I think this one would be really helpful, for us to discuss. And maybe it goes absolutely nowhere, right? It just does not resonate with the client. The intervention that we're utilizing, the discussion that we're having, but with someone else, it works really well and it sticks with them, right? And so just trying to think of, okay, how many different types of skills can we teach people so that, as you mentioned earlier, that they have that toolkit, right, or that toolbox where they can pick from and choose from different types of skills that work best for them. So while, sometimes in my mind, I'll say, okay, I think this one could work well, right? Maybe there are a few others that we want to utilize as well, just to make sure that the client is able to choose what works best for them.
Yeah, I love that approach. And I think it echoes something I heard today in a therapeutic setting, was sort of testing how I felt, reframing what I said, and then saying, like, how does that sit with you? And I say, okay, well, yeah, actually that does sit well, and then maybe that doesn't, and then that kind of connects with, oh, this is a skill or approach, cognitive restructuring or whatever, as the skill for dealing with what was said in that setting. So I think it really does kind of come up intuitively and naturally through the discourse,
Absolutely.
which I think.
Oh,
yeah, sorry, no, I cut you off there.
And I was just going to agree with you. I think, that ability to check in from the clinician side, just like you said, how does that sit with you? Right. And then we get that feedback of, well, actually, this didn't sit too well. Right. Or actually, this one really seems to be a skill that I can benefit from. Right. And as we get to learn about our clients a bit more and kind of learn a little bit more about their personalities and what works well and doesn't work well, we can see, okay, this might be a skill that would be better suited for you. But that openness for a trial and error process too, right? Okay, we're going to learn this skill. We'll see how it works, and we'll kind of reconvene and see, is there a different skill that would be better suited, or is this one a good one for you in this moment?
Yeah, I love that. Not a one size fits all kind of approach.
Exactly.
I see there's a comment coming through here. The skill of stressing less, so stress management, 100%. That's such an important skill. I think that's what I also need to work on a lot more.
Absolutely.
So, yeah. Preventing burnout. These are skills we have on our app. I need to go do my own skills again. Stress management, preventing burnout. Oh, big ones. So how do we integrate skills into practice? And what does that really mean? Right. So psychological skills are obviously used in a range of different settings. And I guess I also should have made this very clear at the beginning. Psychological skills aren't only used by clinicians and psychologists. They're used by specialist wellness practices or practitioners and nurses and life coaches. And they're really used in a range of different settings. And obviously, the quality of the psychological skill is influenced by how evidence-based the tool is that you're using or the approach. And then, of course, the quality of the interaction and the follow-through and how it's taught by the provider and integrated into care and what that looks like. And then obviously we'll look at like knowledge transfer and all of that sort of as we're going. So I guess that's a really important sort of caveat here. And then in these sort of more therapeutic spaces, skills can be used to provide structure and support, as well as improving engagement and insight. And Dan can also, give more of his opinion on that in a bit. And then there's obviously educators and coaches, so in school settings, in sports settings, because that's, as I said earlier, mental skills are a big thing in sports performance. Mental imagery, as an example, was really kind of popularized in sports psychology, and that's kind of where I learned a lot of these things, was in a CBT meet sports psychology space, being trained by Professor Stephanie Hanrahan, so that was really cool. And then there's obviously just everyday life, right? Building quality of life and well-being by implementing these skills and making them automatic, right? I often say, if somebody teaches you goal setting, because it's a skill that we were taught in high school, and it kind of just went in the one ear and out the other. And goal setting, as cheesy as it sounds, really changed my life in quite a big way. But it only happened when I really integrated it and used it more meaningfully. So yeah, obviously that's the core objective here, is getting into everyday life. I see we have somebody else mentioning here that a big skill for them was emotional regulation skill. Thank you very much for that comment. I love it. Dan, I said I'd come back to you about integrating it into therapy and practice. I'd love to hear your thoughts on that.
Yeah, and I think you bring up a great point, Daniel, as well, about goal setting, right? And I know you all have done a webinar previously on goal setting, right? And I think it's such an important component when thinking about psychological skills, because especially, when working with clients or patients, particularly within the realm of therapy, one of the first steps that we take is goal setting, right? Looking at, what is the ultimate goal that the client or patient wants for themselves? What is it that you'd like to get out of therapy at this time, right? And we use goal setting as a collaborative effort, right? And the reason being, it allows us to formulate a course of action in the work that we'll be doing on the provider side, while also allowing the client to have a say in, well, this is actually what I want, from our time together, right? And so once we're able to have the client identify their goal for treatment, and once we start to come up with, goal setting, then we can start to think about, on our side as the provider, okay, what skills would be helpful for the client to learn, right? They've identified, the skill of stressing less, right? I want to not experience so much stress when I'm taking exams in school, right? Okay, well, that's a great goal. And now what skills would be helpful for us to teach you in order for you to accomplish that goal in our time together, right? And so kind of as we spoke about earlier, our clients at some point or another are going to graduate from therapy, right, or complete an episode of care. So how are we ensuring that in our collaborative work together, that we're equipping them with the necessary skills to continue in their respective life goals, right? And so the goal setting, as you mentioned, it plays such an integral role in developing the psychological skills and figuring out just what skills would be helpful for the client to, to learn and utilize. And like you said, that helps with engagement as well, right? Because if we're just teaching a skill to teach it, right, and that's not actually related by any means to what the client is wanting for themselves in terms of their goal, then we're not going to get very far with that client, right? And so making sure it relates to the goal setting, what the client has identified for themselves, that's going to help with that sense of engagement as well.
Yeah, I love that collaborative goal setting and figuring out what success looks like and then implementing those tools 100%. I love that. I have a question to the audience as we're going. What have you found most helpful when teaching psychological skills to clients? What has really worked? And Dan was touching on this. It's collaborative. It has to feel appropriate. The client or the person that you're working with has to buy into the process. But then there's different factors like cultural or personality factors or language and literacy and age and gender and all these things that one has to consider when teaching psychological skills or choosing an appropriate intervention. And I think that's where people might go, well, how do I know if it's going to be the right tool? Or and I can guess, or I can understand that apprehension at times, right? Because you don't want to be prescribing, hey, go do this cognitive restructuring tool, and it's somebody who, it's just going to feel completely overwhelming too. So I wonder if you have any thoughts on that, Dan, on how we can kind of address those kind of considerations.
Absolutely. Well, I think, from what we just spoke about, goal setting, having the client identify what it is that they're wanting out of therapy, right? And then you mentioned something earlier, Daniel, which I love, that sense of, where does this sit with you, right? So those frequent check-ins with clients, right, allows things to not feel so prescriptive, right? It continues to make that therapeutic interaction more collaborative rather than, oh, well, here, I'm going to teach you this skill. You're going to go out and you're going to do it, right? So that sense of collaboration. And, you pose a great question as well in terms of what have you found most helpful in teaching psychological skills. And not to harp so much on the same point, but that sense of checking in with clients, I think, is so valuable. I love when you mentioned having a toolkit or a toolbox, right? And I always use that with clients to say, we're going to learn some tools together in therapy. And I had a session in particular where I was blanking on the word tools, right? we use it so often, and for whatever reason, the word just escaped me. And the only word that I could think of in the moment was the word trick, right? So I told my client, I was like, we're going to learn some tricks today, particularly as it relates to deep breathing. And so we go through this deep breathing activity, and I'm thinking, oh man, this is, we're really doing great work. We're really going through it. And afterwards, I asked the client, I was like, so how did that, experience feel for you? And the client said, well, actually, I felt a little uncomfortable with that word trick. That sense of this being a trick makes me feel like I'm doing something wrong. And I know that breathing shouldn't be wrong, right? And luckily in that moment, I was able to think of the word tools, and I was like, you're absolutely right. So being able to have those check-ins, right? Because what could otherwise be a great skill in that moment, like deep breathing, could be completely overlooked because of our language, because we're not meeting the client where they're at and checking in with them. So I think that that's something that you mentioned that is just so incredibly valuable in the process of teaching skills.
Yeah, I love that. It's really personalizing the approach and finding what works for them, which is what one of the comments here is understanding exactly what the client's needs are. Exactly. And I think something that's also important to keep in mind is that there's no one right or perfect way to teach these skills, right? You want to personalize and you want to use tools that hit the mark, but sometimes it doesn't, and that's also okay.
Absolutely. And those could be opportunities for growth and learning on our end as the clinician as well. And seeing, okay, well, why didn't that work? Right? Was it the way that we explain the skill? Is it just something that doesn't sit well with the client? Are there other, factors like you mentioned? Could it be cultural differences, language differences, age-related differences? Right? So how do we, exactly as the participants mentioned, find out exactly what the client needs are and meet them where they're at as well?
Yeah, 100%. So that kind of leads me to where do skills fit in, right? So obviously I mentioned that there's this huge breadth of psychological skills that we can teach people, and what are the domains of well-being that they influence. So at Psyche Innovations, we've kind of created our own 8 core domains of wellness or well-being, whichever word you want to use. These have different names, but these are ultimately the determinants of well-being. I call them the ingredients to good life. And we have a scale or assessment tool that helps people identify which of these domains they're maybe struggling more in and which ones they're doing better in. And you can kind of take the approach of, well, let's build on the strengths and the areas that we're doing well in, or focus more on maybe deficits and areas of more growth, right? So from the sort of language and perspective we use, when we think about the peace domain, that's spirituality and mindfulness. So obviously mindfulness being one of the items or things that we measure, a skill there is mindfulness meditation, right? Then mood domain, that's emotion regulation and positive affect. And as cheesy as it sounds, on our app and our approach, we have a happiness skill. So like, how do you actually cultivate happiness, or what is happiness? How do we define it? Then there's resilience, which is how you cope with stress, how you bounce back when things are difficult. So those are skills like stress management and time blocking. Making sure that you're setting time aside to work on some of those big tasks that you need to do. And what you'll see through my explanations is like, time blocking sounds a little bit like it might fit into the focus domain as well. You're like focusing your attention. Exactly. Like we're, putting skills in specific domains, just to make it easier to understand from the user perspective. But of course, they're all completely interlinked, right? The classic example I like to use is the physical domain, because it's quite easy to kind of like wrap your head around. We think about sleep, and sleep hygiene as a psychological skill and as a life skill. And through sleeping properly, you can focus more, and your ability to regulate your mood improves. So it's connected to the mood domain. And I think often when clients or just everyday people think about mental health and what they can do, it can feel a little bit overwhelming. It's like this ethereal thing. How do I work on my mental health? What's this actionable thing that I can do? And saying like, okay, well, let's improve your sleep or get you to have an exercise schedule or whatever can, according to the evidence, it makes a huge impact in an individual's life, not only for promoting positive mental health dimensions, which we'll get into some of the sort of most popular evidence-based skills soon. So, well-being, self-confidence and whatever, but also decreasing negative dimensions of poor mental health, so anxiety, depression, those kind of core areas that we often use diagnostic scales to evaluate, improvements in. So that's really the approach that we take. And without, going into all of them, it's about, help seeking in the connection domain, or focus and attention skills in the focus domain, or building optimism and making somebody feel like they're making progress in life in the flourish domain. These are all clinicians, wellness practitioners, and whatever are doing this already. And we're trying to create a framework where people can explain these skills and show progress to clients in a way that makes sense to them. Because I think people can often make progress, but unlike getting on a scale, when you weigh yourself, you can very clearly see, oh, I'm losing weight, or I'm gaining muscle, or whatever, I'm getting healthier. It can be hard to kind of see that. So that's kind of how we think about skills and how they fit into these different domains.
I appreciate, Daniel, you kind of going through and sharing these different domains, because it's so helpful to have them conceptualized in this manner, right? And I just have one comment. I see there's a comment in the chat box about, how do we use these psychological skills at home away from the client setting, right? So recognizing, okay, well, at home, I'm not a client, right? And so kind of two ways of looking at this, from these different domains. One being on the clinician side, it can really help us, if we're working with the client on identifying, just like you mentioned, what is each individual's engagement within those different domains, right? And on the client side, right, or just, each of us individually, really being able to take some time on our own and look at, okay, how am I faring in each of these domains, right? Maybe I'm doing pretty good within the physical domain, right? But the mood domain is something that I'm wanting to work on a little bit more, right? And so just being able to have that ability to take some time, as you mentioned a little earlier too, and engage in that self-reflection, right, could be so impactful. One, for our own knowledge of, okay, here's what I'm wanting to work on. Here's where some of my, good areas are, these domains that I recognize I'm doing really well in, and some areas that I'm wanting to do a little bit more in, right? I'm wanting to focus on a little more. So we can even tell our own therapist, hey, this is an area that I'm wanting to work on a bit more. Or even just for our own recognition of, the mood domain is something that I want to work on. What can I try to do to address that a little bit more, right? And recognizing, exactly as you said, a lot of those domains can intertwine and can impact one another as well. Right, so there's a lot of great self-reflection that can happen from going through those different domains, which is wonderful that your app really addresses those.
Yeah, thanks, Dan. So many good points there. I think one of the values of the approach that we have is, our Psyche scale that helps people measure their mental health and well-being across these domains, which in and of itself has a lot of therapeutic value, because it helps people see, oh, okay, well, how am I doing? And then it tailors and personalizes the approach for which skills that they can learn and do. And to sort of address the comment we have there, in a therapeutic space, the app can be used and psychological skills can be used for the client, for the practitioner, for their own well-being, for their own personal development, to learn skills that better their life, they can do at home, that they can, use for the rest of their life. That's kind of the whole point. And they can also use these skills in therapy. They can use the app or other resources. Obviously, I would prefer people to use our app, but of course there's others out there, right? And they can, integrate them into the care that they're providing, or do it in a more sort of like homework way where they say, hey, here's this resource, go learn these skills, and you can practice them at home in your own time between sessions, and keep people really actively engaged with their mental health care. And that's kind of one of the cells we're trying to do for mental health practitioners, is to show them that by keeping people, like, their mental health journey and their wellness top of mind, they're more likely to continue their mental health journey to completion with their practitioner. Because that's where a lot of the value is coming from, right? Is this person who can provide this wraparound service, but practitioners sleep and eat, and they're humans like the rest of us, even though they do a lot of hard work. So that's kind of our approach and mentality, is that these skills are appropriate to anyone, practitioners, and we actually talk about this later, about like nobody has like figured them all out, right? For their own care and for helping people, but in sessions and between sessions, and even long after, these skills can really change people's lives.
And if I may just add one other point there too, Daniel, with these domains as well, our engagement in those domains can change over time, right? So for example, right now, at this point in my life, I could be doing really well in the physical domain, right? But let's say that I sustained some sort of an injury, right? And so I'm not able to be as physical as I may like, right? Or, it starts to impact my sleep, right? Maybe next month or next year, my engagement in the physical domain isn't where I'd like it to be, right? And so we can constantly use this, even again for our own reflection, to assess frequently, okay, how am I doing in each of these domains, and what is it that I'd like to continue working on, right? Whether we are the client, the practitioner, or just someone wanting to assess for ourselves, right? To have that knowledge and growth.
Yeah, 100%. And I love one of the comments here. People need to shift their understanding that mental health skills are emotional skills for better quality of life for all. And that is our approach. It's that these skills, yes, they can be used in clinical settings, but they are appropriate and applicable to everyone. They can be used in a promotion, prevention perspective, much in the way that we think of like life skills taught at schools to young people, right? That is how these skills work, and we need to have that orientation when we think about how we could integrate these skills into education settings or clinical care. So what are some of the most popular evidence-based skills out there? So when we started preparing this presentation, I said to Dan, like, I'm going to put the 5 most evidence-based skills in there. And he said, that might be a bit risky, because what if they're not, right? And it was a good shout for a number of reasons. There's so much literature out there about mental and psychological skills. And so what we've done is we've chosen some of the 5 highly published on skills, and looked at some of the meta-analyses and systematic reviews that are out there. So these are just some of them. Don't rip my head off. I promise you there are tons more. They did not make the list because of some agenda or anything. These are just good ones, right? So what I've put here is, for those who are just listening and not watching, is we have mindfulness, which falls into the peace domain, as I explained earlier. And mindfulness is obviously about being present, and can include elements of mindfulness meditation, and it's a fairly broad term. But as with all of these skills that I mentioned earlier, they promote positive dimensions of mental health, as well as address and reduce negative symptoms of anxiety, depression. So mindfulness has been shown to prevent or reduce relapse, and as well as enhance well-being. Mindfulness and meditation are some of the most published on psychological skills. Then we also have goal setting, very popular one, helps increase engagement in the therapeutic process, and you obviously create those shared goals, which Dan and I talked about earlier. Helps improve outcomes. So obviously that's, meeting milestones of what success looks like, as well as improves a whole bunch of mental health outcomes. So goal setting is really evidence-based, and also boosts satisfaction in life and the process of growth and change, right? I think I was talking to my friend's mom a while ago, and she's like, "Oh, I don't believe in goals, like I don't want to set these big goals and then they fail, and then you feel disappointed that your life didn't achieve these things." And I think that's also part of goal setting, is like setting these smart, appropriate goals. Like if you're not physically active at all, having a goal to run a marathon or climb Mount Everest is ludicrous, right? You set the benchmark appropriately to that person. And if the goal is just, being able to make a phone call to a friend once a week to, re-engage with their social circle, then that's amazing that you're building towards that goal, right? Just to pull something out of thin air. Then there's, you can see Dad smiling. Then there's cognitive restructuring, again, a broad umbrella term that incorporates a lot of different skills, a lot of CBT-based skills. So we put that in our flourish domain. And cognitive restructuring can be really helpful for reducing anxiety and depression long-term. So interrupting negative cyclical thinking is a big one in cognitive restructuring. Then there's journaling. Tons of value there. There's a whole bunch of different evidence-based journaling approaches. We're actually building a AI or intelligent journaling feature for the app that we're looking to release in the coming weeks. And it includes 5 of the most evidence-based journaling approaches. So that's like narrative journaling, there's gratitude journaling, which falls into a broader theme of positive psychology approaches to journaling. So CBT and thought diaries, as I call it. So there's a whole bunch of different approaches, and you can really find one that works for you as an individual, or if you're working with somebody, finding one that works for them. And obviously, some of the journaling approaches are better for specific diagnoses, for example, PTSD or whatever. So I think that's also a really cool thing about journaling. And overall, it improves mood, improves life satisfaction, optimism. Just want to again reiterate, there's so many things that these things improve that I couldn't fill this whole table. It would just be so messy. And then emotion regulation, right? This is particularly a popular skill when working with adolescents, as we see a lot of in the research. Again, if you'd like to know what research we've been reading, you can reach out to us and we'll send you the articles. So emotion regulation was very popular in working with younger audiences, because it's a skill that's highly important in that developmental stage. Helps lower distress and improves quality of life. So there really are so many cool skills out there. I don't know if you have a question, Dan, to grill me with, or any other comments on that.
I'd appreciate that you mentioned all those different skills. I think they're also important, right? The one thing I may just add, again, comes back to language, right? So how are we explaining these skills to our clients, right? And even for ourselves, our own understanding of these skills. So I've mentioned mindfulness once before to a client, and they said, "Oh no, I don't believe in that." I was like, "Oh, what is it that you specifically don't believe in?" And they were talking about, well, I don't want to engage in any kind of religious focused discussion. And I was like, okay, well, I appreciate you bringing that up, right? Let's talk about what mindfulness really is, right? And so there was this misperception that mindfulness was associated with religion, right? Whereas the skill of mindfulness, we were specifically just trying to focus on being in the present moment, right? And so just kind of hearing some of the terms could be off-putting for some clients, right? Or, journaling. Someone, may say, oh, well, I'm not going to engage in journaling, right? And if we think about gender stereotypes as well, we may hear, oh, well, I don't do that kind of stuff, right? Which oftentimes we've heard before, right? And so talking about, okay, well, what is it behind journaling, right? Why is it that we're trying to express this as a potential skill, and what are the benefits, exactly as you mentioned, Daniel? So a lot of times people may get, turned off just by hearing the specific word, right? So that's where we want to consider language as well.
Yeah, I hear that. It makes me, I'm calling out my dad here. When I talk about therapy and the therapeutic process, he's a 70-year-old man who's an engineer. Just to caveat it, he's like, oh, they're going to make me make a list of everything that's wrong, and then we're going to have to tick off these things in this list, and sometimes people have these perceptions about what the process looks like and what skills look like, and people come in bringing their own baggage and approaches. So obviously we have to communicate in a way that makes sense to the client and for the practitioner as well. As one of the comments was saying, we keep saying client, client, client. We are trying to be mindful of the practitioner as well, right? Right. So knowledge to behavior change is what the title says. So what does that really mean? So our approach for pedagogy is that when we teach psychological skills, there are 3 core sort of steps that are essential, right? So first is the knowledge component. So the things you need to know to learn about it. Then there's the attitudes and beliefs. So how do you feel about this skill or this concept or this idea? And then there's the behavior change. So actually implementing what you've learned into your life, so it becomes automatic or part of your habits, or whatever word you'd like to use there. So the example I often use when I kind of explain this to somebody is medical doctors who smoke cigarettes, right? So they know that it's bad for them. So knowledge in and of itself isn't enough to create behavior change. And behavior change really is the holy grail of medicine and behavioral science. I mean, it's got behavior in the word, right? So knowledge isn't enough, right? So then it's the attitudes and beliefs. Why are they smoking? Do they want to change? What does change look like? Have they tried before? Have they failed? What is their interpretation and belief system around a skill or a concept or an idea? And then there's behavior change. What are they actually going to do? Or what are the actions that are required to replace a negative or harmful behavior or way of thinking or emotional pattern or whatever with something that's neutral or, in best cases, positive, right? So that is the ultimate goal, to get people to buy into it, to know enough, what is goal setting? I want to set goals. This is how I set goals, and actually make progress on them, as an example. And that's really what success looks like for us when we think about teaching psychological skills. Dan wanted to include the trans-theoretical model of change, or stages of change. So Dan, in your experience, how do you handle those early stages of change, especially when a client is resistant or ambivalent about trying something new?
Yeah, and I promise I don't make any commission from the stages of change. Just thought it really resonated nicely with what Daniel was mentioning about, knowledge, attitudes, and behaviors. Right? But, first and foremost, when a client may come in for therapy, right, and they may be ambivalent to change, right, or maybe a little bit hesitant, right, want to look at, okay, so they're talking about some sort of behavior they may want to change, right? So what is it about that behavior that they are wanting to change? Where is it that they're currently at, and where is it that they would like to be at? And what is that hesitancy about, right? So if it's the medical doctor who's smoking cigarettes, right, maybe they'll say, oh, well, yeah, I know that's unhealthy, right? and I feel like maybe I should change, but I don't know, I don't know if I'm ready for that, right? And so then we can explore, okay, well, what would readiness look like, right? What would it look like if you felt ready? If you were ready, what would be different, right? And so we can really spend a lot of time in that exploration process with clients, or patients, or even with ourselves, in terms of any behavior that we're wanting to change as well. And so, those stages of change really, they were developed within the realm of substance use disorders, but they could really be utilized in my opinion. I think they're wonderful for any type of change, behavior change that one is wanting to engage in, right? So pre-contemplation, the individual may be experiencing some sort of negative concern. They may not perceive that concern to be serious enough to motivate some sort of change, right? So they're kind of before that sense of contemplation, right? Contemplation, that next stage, they may realize that the behavior may be concerning or problematic, but again, they're a little bit ambivalent, right? There's some hesitancy, but they're open to the discussion nonetheless about what change could look like, right? Preparation, so they've committed to some sort of change, right? And they've accepted some sort of responsibility of, okay, I want to engage in the change, so let's focus on preparing for it, right? What's everything that we need to do to ensure your success within that preparation stage? The action stage is, all right, we've prepared, we've discussed this, we've discussed, any potential relapse or difficulties with those changes in behaviors. So now let's try to put that into action, right? And then the maintenance stage is continuing to maintain, continuing to check in and ensure that we're keeping up with that, identified change in behavior, right? And so the reason that we go through these stages of change is because information alone isn't enough when we're talking about psychological skills. Again, we could teach all the skills in the world, right? But if the motivation isn't there to want to learn a certain skill, to want to engage in some sort of, self-improvement or some sort of change, so to speak, or if there's no goal within therapy, right, then who's to say that we'll start to implement that psychological skill rather than just, okay, I've learned it, now I'm not going to do anything with it, right? And I'll just add one quick example, is, a primary care provider may say, hey, Daniel, you've got to lose 5 pounds, right? Okay, I recognize they're saying, okay, I need to do this for my health, right? They've told me what I need to do, cut out carbs or sugar, whatever it may be. But if I'm not motivated to make that change, then I've got the information from the primary care provider, but I'm not going to do anything with it, right? So like Daniel mentioned earlier, how do we get the client's buy-in, right? And even if this is something that we're trying to do for ourselves, how do we get our own buy-in to make some sort of change, right? Or the buy-in to utilize a psychological skill, to be open to learning it, right? And to be open to utilizing it and implementing it.
Yeah, I love that. I think buy-in is like a key word there. You got to see it as being important to you. And when we teach goal setting, we, add these 3 kind of like additional P's to it. And one of them is personal, right? Like if you don't connect with it, you don't see its relevance, you're not in the right stage to make that change, it can fall on deaf ears, no matter how well intentioned or taught the skill is. And I think that's a key consideration when we think about psychological skills. So as we move on to the slide, skill versus intervention, I think we need to make an important distinction here. And I'll kind of help make this distinction by asking you a question, Dan. In your clinical work, how do you personally differentiate between an intervention and a skill when working with a client?
Yes, I think it's a great question, especially as you mentioned earlier in this presentation, Daniel, that, psychological skills have so many different names to them, right? So we may call them different things, right? And so for me, with respect to differentiating between the two, a psychological intervention is something that one is guided through, right? Usually by some sort of professional, right? And it's meant to focus on learning or improving a specific type of skill, right? It's structured to help you learn a tool, right, that you can utilize on your own, right? And so, a therapist teaches you to use breathing techniques over the course of several sessions, right? That's the intervention, right? We're going to do an intervention today. We're going to focus on learning these breathing skills, right? A psychological skill is a specific ability that an individual learns, right? And that they're able to practice and implement on their own to improve some sort of functioning, right? So whether it's performance, as you mentioned, sports earlier, whether it's coping, mental functioning, mental well-being, right? It's something that the individual is able to implement on their own after they've learned it, right? And so something that's performed by the individual. And again, we can think of it as the tool that they're utilizing, right? So I've learned the deep breathing within therapy. Now I'm implementing it on my own, right? So using deep breathing to calm myself or to relax is this psychological skill that I'm utilizing, right? And so that's kind of the distinction there between interventions versus skills. What's being taught by the professional in a guided manner versus what's the skill that we're able to take out of our toolkit and utilize for ourselves. I don't know,
I
Daniel.
love that.
Yeah.
No, that was perfect. I think the moving on to an example would be the best way to kind of really hit home with how it works. So could you take us through one or two of these case scenarios?
Yeah, absolutely. So Daniel and I are on other parts of the world, right? But somehow, we meet up at a conference, right? We happen to go to the same conference, and I'm so excited. I see Daniel in person, and so I start to wave to Daniel, right? And he completely walks by me, right? Doesn't acknowledge me, doesn't say a word to me, right? And so I start to feel some type of way, and some thoughts come up for me, right? And so for this example, we'll utilize CBT, cognitive behavioral therapy, some of the skills from there. So within CBT, we look at the ABCs, right? The activating event. So what happened? I waved to Daniel, he didn't acknowledge me, right? B for belief. What's the belief that comes up for me? And C, what are the consequences? So the belief is, oh, well, Daniel must be ignoring me, right? Or I did such a terrible job on his webinar that, he's not going to talk to me anymore, right? Must be angry at me, right? I start to have all these different beliefs that come up. And so the consequence could be this feeling of sadness, right? Or rejection or embarrassment, right? So we go through the ABCs, right? And so now, within therapy, for example, our clinician may help us consider what are some cognitive distortions that we may be experiencing, right? So mind reading, for example, essentially reading Daniel's mind by saying, okay, I know that he's mad at me because I messed up the webinar, right? So I'm assuming what's going on in his mind, right? Or I'm jumping to a conclusion, right? Well, I must have offended him in some way. And so because of that, he's not, acknowledging me, right? So then we go through and we may do some sort of cognitive reframe, right? Okay, well, maybe, he didn't see me, right? Maybe he was rushing to a session, to go watch a presentation, right? Or he was distracted, or he had something on his mind, right? And so we use all of these as interventions within therapy, for example, to teach these skills of cognitive restructuring, right? So learning to identify, challenge, and reframe these unhelpful automatic thoughts that may pop up for us, right? Thought awareness, so becoming aware of what our thoughts are and the fact that they are thoughts, right? They're not facts, right? It's a thought that he must be mad at me rather than a fact, right? We may also utilize emotion regulation from DBT, so trying to manage difficult emotions that come up. It could also be psychological flexibility, so responding more flexibly rather than reacting to internal experiences, and self-compassion, right? So trying to be kind to ourselves even when we feel vulnerable in that moment, right? And so those are all psychological skills that intervention could teach us or can teach a client, right, through that example.
I love that. That was such a brilliant example. because our interpretation of the world isn't always like factual, right? It's so subjective. I could have been ignoring you, and in which case building self-confidence and self-compassion skills might be appropriate. Maybe I was just a jerk, or you're interpreting reality in a way like you're thought or imagine you know what I'm thinking, right? So then different skills are appropriate, and it's this toolbox, you know, of all these different skills and competencies that one develops to navigate through the world. One example of, you know, a case scenario has all these different skills linked to it, and obviously the individual needs to identify which skills are appropriate if possible, and that's also the job of the care provider to say, okay, well, based on this, this is what seems to be most relevant. And I think that's a big challenge, is people don't know what they don't know, right? Like, if you've never come across these terms, which obviously we use in a cognitive restructuring, that's not a term that like the average person thinks about and knows, but there are these competencies that we've picked up along the way, like how we deal with anger. You know, nobody really sat me down and taught me at school or along the way, you know, this is how you experience anger, and this is how you feel, and this is how you like deal with it. And you're dealing with it sometimes in really positive ways and sometimes in really negative ways. And I think that's a lot of the value of engaging in the process of learning these psychological skills, because there's an unlearning process of what hasn't been working, which is often a difficult process, and then a relearning or building skills that we've never ever had before. And yeah, we're short on time, but it would maybe let's do your second one quickly, because I think people really will enjoy these.
Absolutely. So I apologize, Daniel, to use you in this example as well, right? Clearly, my luck with Daniel isn't going very well. First, he didn't acknowledge me at the conference. Right now, I send Daniel a text message, right? And I send him something important, right? And I see that the message says read, right? However, there's no response, right? And so for this one, we'll pull a little bit from CBT and DBT, right? And we'll look at the initial emotional response. So maybe frustration, maybe hurt, maybe some anger, right? Again, we'll take a look at some of those thoughts of I'm being ignored, right? They don't care about me. You know, I always make time for them. I always respond. Why don't they do the same for me, right? We may also take a look at physical sensations, right? So I may notice some tension in my chest, increased heart rate, my jaw is clenched. I'm noticing some heat in my body, right? And looking at our urges as well. So the urge may be to send some kind of passive aggressive message back, right? Or just to withdraw completely. And so, you know, if we're operating from, again, CBT and DBT, we'll utilize a few different interventions, right? So one is we'll look at naming the emotion, right? So I'm feeling a little bit angry and a little hurt, right? We'll check the facts. Have they done this before, right? Is there a chance that they're just busy or overwhelmed? Do I know for sure that this is about me, right? Or maybe there's some other context that I'm not aware of, right? Looking at the reframe. Okay, well, maybe my friend is caught up in something, right? Doesn't necessarily mean that they don't care about me, right? A DBT skill would be doing the opposite action, right? So instead of sending the passive aggressive message or withdrawing, maybe we would do something, again, opposite or neutral, right? So this could be sending a kind message in return. So, hey, just checking in. I hope everything is okay, right? So if the urge is to lash out, then the opposite, you know, would be doing something kind or neutral, right? We would take a look at distress tolerance, so soothing or distracting ourselves. So engaging in some kind of brief activity to bring ourselves a sense of calm or focus, right? So going for a walk, listening to music, doing some mindful breathing, and then validation and self-compassion. So recognizing, okay, you know, it's okay for me to feel upset about this. You know, my feelings are important, they're valid, right? But I don't have to act on them immediately, right? And so we're validating the experience, we're being self-compassionate, And we're also recognizing that this doesn't warrant an immediate, urging response, right? And so all of those interventions together would lead to psychological skills, again, of, becoming aware of our thoughts, right? Our immediate interpretations, and labeling them exactly as thoughts and not facts. Cognitive restructuring, really just a fancy way of saying reframing our thoughts, right? So challenging those automatic thoughts that come up and considering alternative explanations, learning communication skills, right? So expressing our needs or our concerns without attacking or withdrawing. Emotion regulation, so learning to manage our intense emotions like anger, hurt, or anxiety before reacting on them. Distress tolerance, so sitting with that sense of uncertainty and discomfort without acting impulsively. And again, as we mentioned, the skill of self-compassion, right? So again, that we see how the intervention helps teach us all these different psychological skills that, again, with practice, we can try to implement a bit easier than if we were to try this, without any intervention or kind of prior engagement in these skills.
Damn, I love that. At the beginning, we were talking about like how many psychological skills there are, and you've managed to cover, just the tip of the iceberg of them. But you explain them so eloquently how they can be used in such a broad range of ways as part of an intervention. And damn, so cool, Dan. Thanks for sharing those examples with us. I know that you work in a hospital, so if you have to drop out, we won't hold it against you. It has gone over the hour. I'm happy to keep going. So blink twice if you must run.
No, we're good. We're good.
Okay, cool. There's a tough question there, but I think a really nice question that maybe you could give your perspective on, Dan. It's, how does one get unstuck when you intellectually know the skill or tool but fail to implement it?
That is a wonderful question, and it comes back to the point that you mentioned earlier, Daniel, that, we're all still working on these skills, right? And so, we just went through 2 examples of looking at cognitive reframes and restructuring, right? And yet I can tell you, personally speaking, anytime I get a message from my supervisor saying, Daniel, we need to talk, my first thought goes to, oh my God, I'm getting fired, right? What did I do? And so even, we all find ourselves engaging in these automatic thoughts, right? Intellectually, we know, okay, let me reframe this, right? But, our mind goes, to all these different places automatically, right? So it really does take practice, right? Even for the best of clinicians, right? Everybody is still practicing these skills. And one way to try to help get unstuck is if we can practice these skills when we're not experiencing a moment of distress, right? Then it becomes a little bit easier and a little bit easier, so that in a moment of distress or heightened anxiety, right, it almost starts to become the secondhand nature of, okay, I've practiced this before in a non-stressful situation, right? I feel like I can lean on those skills a little bit more, right? And that skill, like we spoke about earlier, of asking for help as well, right? Can I seek some support, from a trained professional or from a trusted colleague or friend of, I'm having this thought, for example, can you help me walk me through this? And so using those skills, that we're speaking about, the skill of asking for help, and just the skill of practicing, right? Practicing in non-threatening and non-stressful situations, so it becomes secondhand nature.
I love that. I think we often think, oh, when the tough time comes, then I will use the skill. And I don't know why, it just made me think of like people who learn self-defense, like you're practicing in a controlled environment so that if ever in life somebody, that dangerous or negative experience happens, you have practiced how to deal with it. And I think psychological skills are exactly the same way. You can't like, oh, I'm super stressed now, I'm gonna like, I've heard of deep breathing before, it's gonna be perfect, and and obviously it will help, of course. But when we're struggling and just surviving, it's not going to be as effective. It's creating this habit of using these skills, which really kind of leads us to our next slide. We are all still learning, right? It's a process of becoming, right? Which kind of leads me to the question that I want to put to the audience is, what skill do you find hardest to teach or use yourself? And for me, at different times, different skills work really well for me, and at other times, I struggle. Interrupting negative thoughts or self-confidence. Sometimes you think like, "Oh, Daniel, you got a webinar. How's it gonna go?" And then you remind yourself like, "Oh, but you've done this before, and you know how it goes." And you kind of draw on your strengths and resources. And that's that toolbox analogy, is building these competencies that we can draw on. And we all have different natural strengths and abilities. And when I was talking about the domains, I was saying, like some you're going to be doing better in and some you're going to be doing, worse in. And I think that's quite a cool thing, is that you can build these skills and competencies to build on the foundation that you have. So sharpening the axe you already have, and starting out with one screwdriver and slowly building your collection. I feel like I'm connecting with the tool-oriented or minded people. Can't just have one screwdriver, you need all of them. And that's kind of my orientation to thinking about learning. And when I started teaching psychological skills in a nonprofit setting, I was working with some first-generation university students who had come from low-resource communities. And one of the young ladies sort of came up to me afterwards, and she was happy, but she was also frustrated. And she was like, "Daniel, I'm frustrated that I wasn't taught these skills in school." Right? Like, it would have made such a big difference to me. And especially at uni, coming from a family that nobody's ever been to university before, I felt so out of my depth, right? And these would have made a huge difference. So later on, she mentioned that she went and she taught these skills to her twin sister and her family, and later on got trained in the intervention that she actually received. And was part of a nonprofit teaching these skills in the community that she came from. And like, obviously that's a really nice story for me and makes me really happy, but it shows the power of this like positive trajectory of learning these skills, and how much more confident and competent you feel navigating through life, knowing all these things. And yeah, I guess that's kind of like why I do what we do here.
And I think it's such an impactful story as well, Daniel, because some of us may think, "Oh yeah, this is a skill that everybody knows," right? And it's simply not true, right? Even as you mentioned with the toolkit, right, kind of sharpening our axes, right? At some point or another, we may even know a certain skill, and yet life happens, and we kind of disconnect from that skill, right? Or we become a little bit rusty with that skill. And so, at any point, it's this continuous sense of how can we just continue to learn this, right? Continue to teach these skills, learn these skills, and share them as well, and make sure that we're practicing them. Because as we mentioned, it can happen to the best of us where we've got these skills, and yet we can disconnect from them, right? And so I love that story.
Thanks, Dan. Yeah, it really is a continual process. And that's really what we do here at Psyche Innovations, and is our approach, is that we try to create resources that are practical, that people can use in everyday life, that can be completely self-directed. Somebody can pick up our app and engage in our webinars or resources and go like, "Oh, okay, damn, there's all these cool things that I can learn." But and of course, are evidence-based and evidence-informed. But it's also an approach, like who is engaging with mental health and really invested in seeing a change in the world. And that's obviously practitioners, the breadth of them that I discussed earlier. And that's kind of what we're trying to do, is not to compete, but to strengthen what practitioners are doing to improve outcomes, to improve engagement, to make the world better without that sounding cheesy, in a complementary way, as well as personalizing care, making people feel that the tools and resources that they're engaging with are appropriate and relevant to them. Because I make this joke a lot, like, yoga is good for you. I don't know if I will ever do yoga. Maybe I will. And the point I'm trying to make there is that not every skill or competency or whatever is going to appeal to you, right? And we completely understand that. And ultimately, the challenge is holistically promoting people's well-being, right? No matter which modality you're focused on, no matter if you're dealing with, quite intense mental or diagnosed mental illness, or somebody who's just looking to thrive and be more well, and trying to facilitate that behavior change. And we do this through, part of the ways we do this is through psychological skills. So we have the Psyche Mental Health app. I really do encourage all of you to go check it out if you haven't already. We take this knowledge, attitudes, and behavior change approach into how we build our skills. Please go check them out. I'd love to hear your feedback. We do a whole bunch of other things, the mental health assessment, workshops and stuff. Obviously, not going to talk about all that in too much detail because this was about psychological skills. So I really do encourage you to go check it out. You can check out our website or just reach out to me. And I would just like to thank the audience for engaging with us. I hope that what Dan and I shared was of interest and somewhat valuable to you. And I, of course, just want to thank Dr. Daniel Balva again for coming onto the webinar. He's got so much experience and so much knowledge, and he's involved in so many organizations. So please do reach out to him if you have any questions or want to work with him. He really is such a great guy. And thank you for being here again, Dan.
Thank you so much, Daniel, for this wonderful opportunity, and as you mentioned as well, for the audience, for such great feedback and questions and commentary, and just for your organization and for the app and the way that you all are making psychological skills and just access to mental health care so much more accessible and within reach. It's truly incredible to see, and it's always a pleasure to be here and very grateful for you.
Thanks very much, Dan. Thank you, everyone, for attending. If you're a mental health professional, please reach out. We'd love to engage with you. Keep well, and hopefully we can have Dan on again. Cheers, everyone.
Bye, everybody. Thank you.